Okay, good evening, everyone. My name is Melinda Carnesal. I'm the Deputy Director of Operations from the Children's System of Care. It's great to see you all here. Joined here tonight with our Assistant Commissioner, Molly Green, our Assistant Director of the Office of Constituent Affairs, Alex Encarnacion, and I believe 2 staff members from his office, Patricia Burnaby and Sherry Gallo, are here. And I'd also like to just say thank you to Jonathan Seafried, the Assistant Commissioner from DDD, and Paul Aronson, the IDD Ombudsman. Thank you both for joining us as well. We're here tonight. We're joined by a team from Rutgers who has been working pretty hard for the last 2 years on the IDD Family Survey. So before I turn this over to our Rutgers team, I just want to say thank you so much to the council. It's probably almost been about 2 years now that I reached out to Kyoko and asked if we could have your help in really formulating the language and getting some feedback from your perspective on the survey questions and just any input that you had on rolling this out. And I believe we went back and forth probably about 4 times with different versions of your feedback. So thank you so much. And because of all your help, we really wanted to dedicate a webinar and a presentation to you with the feedback from this survey. So with that, I'm going to turn it over to our Rutgers team to introduce themselves and to get started on the presentation.
Great. Thank you very much, Melinda. Good afternoon, everybody, or good evening, I guess, at this point. I'm Margaret Kohler. I'm the Executive Director at Rutgers Center for State Health Policy. And as Melinda said, we have been working with the department over the last 2+ years on a series of projects under a larger study, really looking at family strength surveys through that started during the height of the pandemic to really assess the challenges that have been experienced by the families, all the families that you serve. So what we'll talk about today, that my colleague Ann Wynn will talk about, is really just one component of a larger study that'll be wrapping up in the next several months. And we'll be providing, updating you on findings from each of the components, and look forward to potentially sharing, more conversations about some of the key topics. But today we're going to be talking about the specific survey of kids with IDD, families that have youth with IDD. But first, let me just introduce my colleagues who really have just done the lion's share of the work. And I'll start with Jennifer Farnham, senior research analyst at the center. Jennifer.
Yeah, hi everybody. Thanks so much for being here, and a really, a big thank you to Melinda and her team and Kyoko and others who gave a lot of feedback on this survey and really helped us hopefully represent and get the information that from families. And so yeah, we hope you like this, and I'll pass it on to Ann Nguyen.
Hi, I'm Anna Wynn. I'm on faculty. I've been working with the Rutgers Center for State Health Policy for 3 going on 4 years now. And so I will be presenting the results of the survey to you in just a few moments. But I'm going to hand the baton over to the last member of our team that's online here, Jolene, to introduce herself.
Hi, everybody. Jolene Chow. I'm a senior research analyst at the center, and I mainly work on the data analysis for this and all the other projects, all the other surveys on this project, and yeah, with obviously with everyone's help. Nice to meet you, everybody.
And I'd just say, before Ann kicks off, that we also have 2 companion issue briefs that Ann is going to touch on and mention for distribution that really reflect the findings in that she'll be sharing in the slide deck. But there are 2 issue briefs that we produce that'll be on our website that can be circulated as well, and we'll provide the link. So without any further ado, Ann, do you want to walk us through the findings, if you would, please?
Sure. Thanks, Margaret. And thanks for mentioning that, because as you're welcome, of course, to take, pictures and notes of the slides, but there will be some takeaways after this that you can just download and have a handy PDF in front of you. So I'll go ahead and share my screen. All right, and again, I'm delighted to be presenting the results on behalf of our team here at the Center for State Health Policy at Rutgers. This family strength survey is one of many that's focused on parents and caregivers of children who have intellectual and developmental disabilities, which I'll refer to as IDD for short moving forward. The outline for this presentation is fourfold. First, we're going to start with a brief overview of how the data were collected. And then second, what was our approach to analyzing the data? And then third, the main reason why we're here is to hear the findings from the surveys. The survey findings have three parts to them. First, we're going to talk about who actually responded to the survey. And then we're going to jump into, for the caregivers and parents who responded to the survey during this pandemic period, what were their support systems like, and what were the things that were creating stressors for them? Again, this is caregivers and parents of the youths with IDD. We're going to pause briefly after this to address any clarifying questions, and then move back into talking about the children with IDD, specifically their health status and their access to healthcare during this pandemic time period. Then we'll leave some time at the end to discuss, because the reason why we're presenting to you here is that we really want to hear from you. What are your reflections on what was going on, and where can we move next? So starting with the data collection, the survey was conducted between November of 2022 to October of 2023. So if you think about, this time about a year ago, we were, on data collection. There were three cohorts or groups of parents and caregivers of children with IDD who received the survey link. The first one came from DCF, so the Department of Children and Families email listserv. These surveys were incentivized with a gift card, and there were a little over 500 respondents at that first wave of survey. The second, we continued to keep the survey open, and those surveys were not incentivized. There were about 300 respondents in that round. And then the survey was open to the public, to those that met the eligibility criteria of being a parent or caregiver of a child with IDD. Those surveys were not incentivized with a gift card, where there were about 60 replies in that round. Each of the parent and caregiver that received a survey was asked questions about themselves, as well as questions about each of their children who have IDD. All of these surveys were done, I believe, online. The analytical approach we did was we first combined all of the cohorts, and then we checked to see if the cohorts looked or behaved differently, and they didn't, so it was appropriate to do so. Now that we combined all of the three cohorts together, we created two groups. There was data about the parents and caregivers, and there were 901 of those. And these parents and caregivers, they gave us some ideas or insights into their children with IDD, and though there were about 1,110 of those. The variables of interest in this work were, at the parent and caregiver level, the support systems and stressors. At the child with IDD level, we were looking at questions pertaining to the child's reported health status, which means the general overall level, as well as their mental health. And then we were looking at their access to care, and then finally their satisfaction with the care that they received. Where it was feasible to do so, we took our survey findings from this child with IDD survey and compared it to the 2021 statewide survey that was part of the same Family Strength series. And that gave us an idea of how were the caregivers and parents with children with IDD doing compared to the broader population of New Jersey caregivers. And in that survey, there were 1,449 respondents. What we then did next was we stratified again where possible at the geographic region, race, ethnicity, and then the primary language of the household. We defined that as English-only households compared to those that were multilingual or did not speak English as their primary language. The findings that you'll be hearing about are those where the key trends and findings were statistically different from one another using some p-value scores. And I do want to acknowledge that there were a couple limitations to these findings, just to keep in the back of our heads, is that for the child's race and ethnicity, we didn't have that specific information. So we did have to use the parent and caregiver's race ethnicity as a proxy to estimate the child's race ethnicity. But we do recognize that those are not always the same. The second limitation is that, especially when we were stratifying by these smaller groups, the numbers became really small and made it not possible to compare across these groups. So then we were not able to do that. So moving right into the findings. So who responded to the survey? So the format for the finding section of this is gonna be repeated over time. So I'll start off with a slide that has the key takeaways, usually 4 or 5 things to learn or take away about this part of the presentation. And then I'm going to dive into the details. So all 3 of these sections will feel the same. So the first key takeaway about who responded to the survey, well, we got respondents from all 21 counties across the state, which was great to see. Most of the respondents were non-Hispanic white. They were mostly over 45 years old. They were college educated and mostly living in English-only speaking households. About 80% of the respondents have 1 child with IDD. The remaining 20% had more than 1 in their household. And then compared to the statewide survey of caregivers, the respondents in this survey were slightly less diverse, they were older, and they were more educated. So now I'm going to dive into the details of each of these. Whenever we talk about geographic distribution, I'll have this map up on the screen, and the colors show how each of the regions are defined. So really quickly, like the green one is ex-urban, the blues you see at the bottom are South Philadelphia, and so on and so forth. So the first finding, and you'll see on the right side, I have this Post-it note looking thing, is a key point or the key takeaway from each of these graphs that I'll be showing in the middle of the screen. So in terms of how this was distributed, there were respondents again from all 21 counties, and they represent all 5 regions, though where about 1/3 of them are coming from the suburban region, which is the orange on the screen. For race ethnicity, when we are comparing some of these stratifications, we'll first show you here for IDD caregivers. You'll see that 60% of the respondents of the 901 respondents are non-Hispanic white. And then the distribution is as follows. Where we have that data, we'll compare it to the caregivers at large across New Jersey. Do note the different time points. But we do see that the IDD caregivers are slightly less diverse than the caregivers in the statewide survey. So that's how the format's going to look. So the respondent age, you also see now that the IDD caregiver respondents are slightly older than the caregivers statewide. And then the IDD caregivers have higher levels of education than the caregivers statewide. And then the IDD caregivers have a similar level of English-only speakers as the caregivers statewide. The data point I mentioned earlier is that 20% of the IDD caregivers respondents had 2 or more children with IDD in their household. So that kind of gives you a context of who we'll be talking about in the next 2 segments, the main findings of the survey. So first, we'll talk about the parent and caregiver, particularly their support systems and stressors. So the key takeaways from this portion, I'm going to note first that in the bullet points I'll have up on the screen, we'll have some letters that are in parentheses. These letters are indicating that when we disaggregated by the different subgroups I mentioned earlier, we found statistically significantly different disparities. The G's will stand for geographic region, the R stands for race ethnicity, and the L stands for primary language. So the first key finding was that over 1/3 of parents and caregivers of children with IDD were experiencing food insecurity during this pandemic time period. And the R here indicates that we saw that there were differences when we looked at this across the race ethnicity groups. The IDD caregivers were also more likely to have food insecurity compared to caregivers in the statewide survey. The second takeaway is that many of the IDD caregivers had living and home situation changes since 2020, and there were differences by race ethnicity. Third, 1/3 of the IDD caregivers were reporting depression, anxiety, and that they were feeling lonely. We were seeing differences by the primary language of the household. These respondents were also more likely to report these conditions than caregivers in the statewide survey. And then 4, over 1/3 had insufficient support systems. And then finally, most felt very safe where they lived, though there were differences by the geographic region, race, ethnicity, and language in the household. So next, I'm going to jump into the details for all of these findings. So food insecurity overall. When you add up the food insecurity of those reporting that they were sometimes insecure or often insecure with their food in the household, 37% of IDD caregiver respondents were reporting food security at least some of the time. The IDD caregiver respondents were also more likely to report food insecurity compared to caregivers in the statewide survey. We did see differences by race ethnicity. So looking at the Black, the Hispanic, and then the multiracial IDD caregivers, they were more likely to report food insecurity compared to their white and Asian counterparts. Looking at food insecurity by primary language, half of those who were living in multilingual or whose primary language was not English reported food insecurity at least some of the time. They were also more likely to report food insecurity compared to those living in English-only households. We saw some changes in the living and job situation overall. 27% of IDD caregivers had a change in their living situation since 2020, and 62% of them had at least one job change one change in their job situation. Job situation could mean that there was a change in the number of hours they worked, a change in the job that they held, and a change in their position. And then we saw that there were changes in the living and job situation differing by race ethnicity. So Black and Hispanic IDD caregivers were more likely to have a change in their living situation since 2020 compared to the other racial ethnic groups. And over 60% of respondents in the white, Black, and Hispanic groups had at least one change in their job situation since 2020. So looking at depression and anxiety overall, this was measured using the PHQ or the Patient Health Questionnaire 4, where we looked at those that had scored in the moderate to severe level of depression and anxiety. And we saw that 30% of IDD caregiver respondents were reporting moderate to severe depression and/or anxiety during this time period. They were more likely to be depressed and/or anxious than their caregivers statewide. You can see the differences in the numbers here. For loneliness, we looked at those that responded that they were usually or always lonely in the past 2 weeks. 18% of IDD caregivers were reporting usually or always lonely in the past 2 weeks. And they were more likely, as you can see, to report feeling lonely compared to the caregivers in the statewide survey. There were differences by primary language in the household, where we saw that 59% of IDD caregivers in a multilingual or non-English household were reporting feeling lonely in the past 2 weeks. And they were also more likely to feel lonely compared to the English-speaking IDD caregivers. And related to the loneliness question, we were looking into social support systems that they have. The question was asked in two different ways. It's whether they had support in the past 2 weeks and whether they had access to support since 2020. So we saw that 36% of IDD caregiver respondents were reporting rarely or never having social support in the past 2 weeks. They were also less likely to feel socially supported, at least sometimes, compared to the caregivers statewide. The IDD caregivers are also more likely to report that this support worsened since 2020. It was important to note that this was looking only at change. So if somebody said that they always had support in the past 2 weeks and now they only have sometimes, that was still counted as a worsened. And then there was a question we were looking at that was, do you know where to get help to make ends meet? And we looked at somewhat disagree or strongly disagree to that statement. 38% of IDD caregivers did not know where to go to get help if they wanted to make ends meet. They were less likely to be able to get help compared to the caregivers statewide. And then we were looking at whether the household was getting along overall. So there were questions around, does the household get along? And are you getting along with your child or children? So we saw that 1/4 of IDD caregivers said that their household members were getting along very well and that they were getting along with their children also very well. They were less likely to say that the household members were getting along very well compared to the caregivers statewide. And they were also less likely to say that they were getting along with their children very well compared to the caregivers statewide. And then finally, we have a question around feeling safe, safe in the neighborhood, and then safe at home. So 66% of IDD caregivers reported feeling very safe in their neighborhoods, and 75% felt very safe at home. They were less likely to say that they felt very safe in their neighborhood compared to their caregivers statewide. But they were also very less likely to report feeling very safe at home compared to the caregivers statewide. There were differences by region. So we did see here that 42% of the respondents living in the urban area, which is defined as Essex and Hudson counties, were reporting very safe in the neighborhood. And then just scanning across the row here, you see that the other regions have 64 or 70% plus saying that they felt very safe in their neighborhood. We do show the safe at home below, but there were not statistically significant differences between them. And then finally, feeling safe by race ethnicity. We are looking at now non-white IDD caregivers. We're saying that they were less likely to feel very safe in their neighborhood at home. The weight percentage is 73. And then in their neighborhood as well as at home. And then we have 80% compared to lower percentages in the other groups. And then looking at feeling safe by primary language, IDD caregivers who are in multilingual or whose primary language is not English were less likely to report feeling very safe in their neighborhood, as well as very safe within their homes. So I'm going to take a brief pause before we look at the findings for the children with IDD to see if there are any clarifying questions. I imagine there's a lot of desire to have a conversation about this, but I'll leave it to Melinda to decide if we want to talk about it now or if we want to leave it till the end.
Kathy, was there anything that you wanted to clarify at this point, or do you want to wait until the end of the presentation?
I think we should go till the end of the presentation. Thank you.
Okay, thanks.
Great, thank you. All right, so findings for the children with IDD, specifically their health status and their access to healthcare. So again, starting with the key takeaways, we have the same letters indicating disparities when you disaggregate by geographic region, the G, race ethnicity, the R, and L for primary language. So the first key takeaway from this group is that almost 60% of children with IDD had reported a health status of very good or excellent during this time period. Some of the children with IDD, 11%, reported through their parent or caregiver who was responding to the survey that they cannot get access to needed mental health treatment. And there were differences by the geographic region and the primary language in the household. Half of those children with IDD were reported to have access challenges for mental health treatment or just care services in general. Most of the respondents had said that they have had contact with CSOC, or the Children's Systems of Care, and 58% of them who did reach out to CSOC received services. There were differences by geographic region. It is important to note here that one can reach out to CSOC for a number of reasons, including just requesting information. And then lastly, among the recipients of CSOC services, a large majority of them found that these services were well designed and are satisfied with the services. So we'll go into the details now. So health status, general health overall. So looking at the children with IDD, there will not be a comparison group with the statewide survey, because that survey was looking at caregivers and parents overall. There was no comparison for children. So the key takeaway here is that almost 60% of the children with IDD were reporting very good or excellent general health status. But you can see here, 29% reporting good and 11% at the fair or poor level. Just noting that this is a sample size of 1,110. For the health status, there were questions around adverse impact on their daily activities over the last year. And then we were assessing the frequency of adverse impact on daily activities and the extent of the adverse impact on daily activities over the past year. So we saw that when we combined the usually and the always categories, 45% experience adverse impact on daily activities. The disabilities had a somewhat or a great deal of impact on most of the children with IDD. For access to care, we looked at mental health treatment over the past year, and there were questions around whether or not they received treatment. Yes, no, even though they needed it, or they did not need mental health treatment. And then among those who received or needed treatment, which was a smaller number of individuals, whether they had access challenges to that mental health treatment. So we saw here that 11% reported not getting access to mental health treatment in the past year, even though they needed it. 42% reported access challenges for mental health treatment, which we were defining as very difficult or impossible to get care. And there were differences by region. So we saw here that 17% of those living in the ex-urban area, which is the green at the top left of New Jersey, did not receive, even though they needed mental health treatment. About half of those residing in the ex-urban and the South Philadelphia residing areas reported that it was very difficult or impossible to get mental health treatment in the past year. We also looked at how this changed by the language in the household. The children who are living in multilingual or non-English primary language households were more likely to report not receiving mental health treatment, even though they needed it. So then we looked at access to care frustration with getting services over the past year. Combining the usually frustrated to always frustrated categories, we saw that 45% reported that they are usually or always frustrated with getting access to services over the past year. Looking at access to CSOC services overall, in this survey, most of the children with IDD in the survey had contacted CSOC, and 58% of them in the survey had received services that they could comment on. I'll say again that we don't know exactly the reason for contacting CSOC and whether that translates to them requesting services or requesting information or something else. We did do an additional analysis and we found that the mental and social well-being is similar between those who received services and those who did not receive services from CSOC. So looking at the CSOC services by geographic region, we did see that access is not equal across the regions, with the urban residing areas having the lowest access to CSOC services. Down here. And then looking at satisfaction, so among those that did receive the CSOC services and could comment on it, we were looking at whether they found the CSOC services well designed and if they were satisfied with the CSOC services. So among the recipients of CSOC services, a large majority of them found that these services were well designed at least some of the time, and they are satisfied at least some of the time. So that concludes the presentation of the two segments, the primary segments of our findings. Like Margaret mentioned at the top of this, that we do have issue briefs that are about 5 pages each that summarize the findings from these two surveys. The one on the left side of the screen you see is about the children and their access to their health status and the access to healthcare. And then we have the one on the right for the support systems and stressors of parents and caregivers. I think Jolene has just put into the chat a link where you can download both of those. They have the same information, just visualized a little bit differently so that they fit in fewer pages. And they're available on our website if you want to point others to this, tool. So thank you for your time, and then I will hand it back to Melinda for a discussion.
Thank you so much, and thank you for all the time and effort that was put into this, not just the survey, but in preparing this presentation and joining us tonight.